Hello, good evening and welcome to the commentary segment of the evening news. My name is Kofi Owusu-Ansah, and tonight our message goes squarely to doctors and other healthcare providers, and all we are saying is don't shroud medical practice in secrecy. Until recently, when the Ghana Health Service insisted on running malaria tests before giving a prescription, all one needed to do was to go to the hospital, report fever and headache and the feeling of hot or cold, and one would be given the chloroquine drug. One visits the hospital and tells the doctor one has headache. One was immediately given medication without being told what one was being treated for. But at the prayer camps or fetish priest shrines, at least the person doing the consultation is privileged to be told who or what is causing what and why the illness. Whether these divinations are reliable or unreliable, ours is a largely superstitious society that really enjoys listening to supernatural interpretations of our ailments and other woes. But all these medications without much examination and superstition instead of proper diagnosis have cost families and this nation dearly. Many people have died needlessly from illnesses which they would have been cured of if detected earlier. Such curable ailments as typhoid fever have symptoms similar to malaria, but it could be treated wrongly for malaria. But woe betides you if you dare question your public hospital doctor while he or she is administering A or B drug on you. Many doctors were and are still demigods that work unquestioned in spite of the Ghana Health Service Patients Charter, granting the patient the right to full information on his or her condition and management and the possible risks involved, except in emergencies. Is it surprising that in Ghana, the average person has no idea of his or her blood group, sickling status and the like? In fact, you are considered irritating if you report to the hospital after 10 p.m. Even those at the record section will, with a wild frown, ask you why you are coming to the hospital at that time. The reason some private health centers have gained popularity lies simply in how the doctors there take time to explain things to their patients. Sometimes, one thinks it is impossible to achieve these good practices in government hospitals. Usually, the same excuses of patient-to-doctor ratio and blah 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 go on and on, but we hold the view, and strongly so, that medical practice should not be shrouded in secrecy. We all have the right to medical information about ourselves. Let's start advocating and demanding for better healthcare services, attitudes and practices. As the saying goes, health is wealth. Well, that does it for the news commentary segment. It's back to the newsreaders.